Assalamu alaikum. Today we will continue our discussion about the anatomy of the forearm, part 2. To start with, we will study the forearm from the skin downward. Skin of the forearm supplied by sensory nerve from the following branches. First, anterior and posterior branches of lateral cutaneous nerve of the forearm, which is a continuation of the musculocutaneous nerve. Second, from anterior and posterior branches of the medial cutaneous nerve of the forearm, which is branch of medial cord or brachial plexus. The third, from posterior cutaneous nerve of the forearm, which supply skin over the posterior surface of the forearm. You can see on the medial side of the forearm, skin is supplied by branches of the medial cutaneous nerve of the forearm. On the lateral side, supplied by branches of lateral cutaneous nerve of the forearm, and posteriorly by posterior cutaneous nerve of the forearm. Next is the superficial veins. As you know, the upper limb is drained by two main venous system, superficial venous system, one that lies on the lateral side, which is the cephalic vein, which arises from the lateral side of the dorsal venous arch on the back of the hand and passes on the lateral side of the forearm, ascend on the lateral sides of the cubital fossa and the arm on the lateral sides of the biceps muscle, and it terminates in the axillary vein in the deltopectoral triangle. Second venous system is the basalic vein. It arises on the medial side of the upper limb, started from the medial side of dorsal venous arch on the back of the hand, passes along the medial border of the forearm and ascends in the cubital fossa in front of the arm on the medial side of the biceps muscle, and it ends by joining the vena committant of brachial artery to form the brachial vein. Along their courses in the upper limb, as you see on this figure, this is the cephalic vein and this is the basalic vein, and along their courses in the upper limb, these two venous systems, they have a lot of communications between each other along their course in the upper limb. And an important site for communication is in front of the cubital fossa by an important vein, as you see, median cubital vein. Median cubital vein is a branch of cephalic vein in the cubital fossa, and it runs medially joint basalic vein. And the cubital fossa, the median cubital vein, crosses in front of brachial artery and median nerve, separated from both by septal aponeurosis. What about the lymphatic drainage of the forearm? As a general rule, the lymphatic drainage of upper limb is drained, generally speaking, to the lateral group of the axillary lymph node. What about deep structure in the forearm? Facial compartments of the forearm. The forearm is enclosed in a sheath of the fascia, which attached to the periosteum on the posterior subcutaneous border of the ulna. And this fascia, together with an important membrane called interosseous membrane and different fibrous intermuscular septa, they will divide the forearm into several compartments, mainly 3 compartments: anterior compartment, posterior compartment, and lateral compartment. Each compartment, it has its own blood supply, nerve supply, and muscle groups. This is a transverse section in the forearm, shows the bony skeleton, radius laterally, ulna medially, the fascia of the forearm encircling the whole forearm and attached to the posterior border of the ulna. Radius and ulna, they are attached together by an important membrane, interosseous membrane, and this membrane will divide the forearm into anterior compartment and posterior compartment. Another facial layer, less well identified, it will separate a lateral compartment of the forearm, as you see. Interosseous membrane is a strong membrane, unite the shaft of the radius to the ulna. It is attached to their interosseous borders, and it provides an important attachment for the neighboring muscles. This is the interosseous membrane. Another entity in the forearm, which is called flexor retinaculum. Flexor retinaculum is a thickening of the deep fascia that holds the long flexor tendon in position at the wrist. Long flexor tendon, it refers to the tendon of the muscles of the anterior compartment of the forearm. This retinaculum, it stretches across the front of the wrist and convert this area, the concave anterior surface of the wrist, into an osteofacial tunnel called carpal tunnel. This is an important tunnel, permits the passage of median nerve and the long flexor tendons of the fingers and the thumb. You can see in this dissection of the anterior aspect of the wrist, this is the flexor retinaculum. Flexor retinaculum, you can see that the tendon of the long flexor muscles of the forearm, they passes deep to the flexor retinaculum to reach to their insertion in the hand and the fingers. Also, an important structure passes deep to this flexor retinaculum is the median nerve. Flexor retinaculum. It is attached medially to the pisiform bone and hook of hamate, and laterally to the tubercle of scaphoid and trapezium bone. These are carpal bone. The upper border of the retinaculum, it corresponds to the distal transverse skin crease in front of the wrist. It is a continuous layer with the deep fascia of the forearm. The lower border of the flexor retinaculum, it attached to the palmar aponeurosis. Palmar aponeurosis refers to the deep fascia of the hand, palm of the hand. And this is the proximal border of the flexor retinaculum, and this is the distal border of the flexor retinaculum. You can see it is continuous with the palmar aponeurosis, which is the deep fascia of the palm of the hand. Transverse section through the wrist joint shows the carpal bone, hamate, captate, trapezoid, trapezium. This is the flexor retinaculum. You can see there are different or multiple tendons of the muscles that passes behind or deep to the flexor retinaculum as they pass from the forearm to reach to the fingers and the hand. These muscles also, they are nearby to an important nerve which passes deep to the flexor retinaculum, which is the median nerve. This area, it has another name called carpal tunnel. What are the contents in the anterior facial compartment of the forearm? First, muscles. And the muscles in the anterior compartment of the forearm, there are three groups of muscles. First one, superficial group, consists of the following muscles: pronator teres muscle, flexor carpi radialis, palmaris longus, flexor carpi ulnaris. Second group, intermediate group, which is composed of the muscle which is the flexor digitorum superficialis muscle. A deep group consists of flexor pollicis longus, flexor digitorum profundus, and pronator quadratus muscle. There are general rules will help you to remember these muscle groups. First, general rules: most of these muscles, they are large muscle. They have origin in either in the forearm or originate from the common flexor origin from the medial epicondyle of the humerus, if you remember. This is the first. Most of these muscles are flexor muscles. This means their action is either flexion of the wrist or of the fingers or of the thumb. Third general rule, that all these muscles are supplied by median nerve, except two muscles, which is the medial half of flexor digitorum profundus muscle, medial half of flexor digitorum muscle, and flexor carpi ulnaris muscle. These two muscles are supplied by different nerve, which is the ulnar nerve. Blood supply to the anterior facial compartment of the forearm is derived from ulnar and radial arteries. Nerve supply, as you know from the general rule that all muscles of the anterior facial compartment of the forearm supplied by median nerve, except flexor carpi ulnaris muscle and medial part of flexor digitorum profundus muscle, which are supplied by ulnar nerve. So, arteries of the anterior facial compartment, two arteries. First one is ulnar artery. The ulnar artery is a terminal branch of brachial artery. It is the larger one of the two terminal branches of brachial artery. It starts in the cubital fossa at the level of the neck of radius, and it passes in the anterior compartment of the forearm to enter the palm of the hand in front of the flexor retinaculum in company with ulnar nerve. It ends in the palm of the hand by forming a special structure in the palm of the hand called superficial palmar arch, and is often anastomosed with superficial palmar branch of radial artery in the upper part of its course. The ulnar artery lies deep to most of the flexor muscles, and when it reaches the region of the wrist, it becomes superficial, lies between the tendon of flexor carpi ulnaris and the tendon of flexor digitorum superficialis in front of flexor retinaculum, just lateral to the pisiform bone. This is an important anatomical landmark, since the artery here, it is covered only by a skin and fascia, and here it is a site for taking the pulse, ulnar pulse. Branches of ulnar artery, muscular branches. Recurrent branches take part in arterial anastomosis around the elbow joint, and branches that form anastomosis at the wrist joint. An important branch which is called common interosseous artery. It arises from the upper part of the ulnar artery, and after a brief course it divides into two important branches. One is anterior, the other is posterior interosseous arteries, and the interosseous arteries, they are distributed to the muscles lying in front and behind the interosseous membrane, and they provide nutrient arteries to the radius and ulna. This diagram shows the brachial artery and the cubital fossa, and by division into two terminal branches. This is the ulnar artery, and this is the radial artery. As you see, the ulnar artery is the larger branch, terminal branch, and here it gives the interosseous artery, common interosseous artery, which by itself it will divide it into two branches. One is anterior interosseous, the other is posterior interosseous arteries. Here, this diagram shows the terminal part of the course of the ulnar artery at the wrist joint, where it becomes superficial and it is covered only by skin and fascia, and here ulnar pulse can be detected on examination. Second important artery in the forearm is the radial artery. It is a smaller terminal branch of brachial artery, begin in the cubital fossa at the level of the neck of radius, passes on the lateral side of the forearm beneath brachioradialis muscle, resting on deep muscle of the forearm. In the middle third of its course, the superficial branch of radial nerve lies on its lateral side. In its distal part in the forearm, the radial artery lies in the anterior surface on the anterior surface of the radius. It is covered only by skin and fascia. Here it is an important site where pulse of the radial artery can be detected, and this is what's called radial pulse. The radial artery leaves the forearm by making a wind around the lateral aspect of the wrist, passing from the forearm to the posterior surface of the hand. On this diagram you can see this is the brachial artery, and here it is divided into radial artery and ulnar artery, and you can see the course of the radial artery. When it distal part in the front of the wrist, it becomes superficial and covered by skin and fascia. Here it is easily palpated through the skin, and here is the site where radial pulse can be taken easily. Branches of the radial artery in the forearm: muscular branches, recurrent branches, superficial palmar branch that arises just above the wrist and enter the palm of the hand, and it is frequently, it will join the ulnar artery in the palm of the hand to form superficial palmar arch. Another important content in the anterior compartment of the forearm, these are the nerves of the anterior facial compartment of the forearm. The first is the median nerve. As you know, median nerve is an important branch from brachial plexus, coming by two routes from medial cord and lateral cord of brachial plexus, and the median nerve cleaves the cubital fossa by passing between the two heads of the pronator teres muscle. It continues downward behind the flexor digitorum superficialis, rests posteriorly on the flexor digitorum profundus. At the rest, the median nerve, it emerges from the lateral border of flexor digitorum superficialis, and here it lies behind the tendon of the palmaris longus muscle. It enters the palm of the hand by passing behind the flexor retinaculum. This is an important relation, which means that it passes through the carpal tunnel. Branches of the median nerve gives muscular branches. It gives articular branches, gives anterior interosseous nerve, and give palmar cutaneous branch, which is a branch arises in the lower part of the forearm and is distributed to the skin over the lateral 2/3 of the palm of the hand. Anterior interosseous nerve arises from the median nerve, an important branch of median nerve. As it emerges from between the two heads of pronator teres, it passes downward on the anterior surface of the interosseous membrane, and from this it takes its name, between the flexor pollicis longus and flexor digitorum profundus. It ends on the anterior surface of the carpal bone, or the carpus. Give muscular branches to flexor pollicis longus, pronator quadratus, lateral half of flexor digitorum profundus. Gives articular branches to the wrist joint and distal radio-ulnar joints. This diagram shows the median nerve and the anterior interosseous branch. Second important nerve is the ulnar nerve. The ulnar nerve is a branch, as you know, from the medial cordobrachial plexus. It enters the forearm after the passes behind the medial epicondyle of the humerus, crosses the medial ligament of the elbow joint, entering the front of the forearm by passing between the two heads of flexor carpi ulnaris muscle, and runs downwards through the forearm between the muscles flexor carpi ulnaris and flexor digitorum profundus. In the distal 2/3 of the forearm, the ulnar artery lies on its lateral side of the ulnar nerve. At the wrist, the ulnar nerve will become superficial and lies between the tendons of flexor carpi ulnaris, flexor digitorum superficialis muscles. The ulnar nerve enters the palm of the hand by passing in front of the flexor retinaculum. This means it passes outside the carpal tunnel, on contrast to the median nerve, and it passes on the lateral side of the pisiform bone. The ulnar artery here lies lateral to it. This diagram shows the ulnar nerve as it passes on the lateral side of the ulnar, on the medial side of the ulnar artery, since the artery lies on its lateral side, and it passes into the palm of the hand. An important point, it passes outside the carpal tunnel. Branches, muscular branches. القاعدة العامة تقول all the muscle of the anterior compartment of the forearm supplied by median nerve, except two muscles. This is the flexor carpi ulnaris muscle and the medial half of flexor digitorum profundus muscle, which are supplied by ulnar nerve. Another branches of ulnar nerve in the forearm, articular branches to the elbow joint, and also it gives palmar cutaneous branch, which is small branch. It is responsible for supplying the skin over the medial 1/3 of the palm of the hand, which called hypothenar eminence skin. Another branch, which is called dorsal or posterior cutaneous branch of the ulnar nerve, which is a large branch of ulnar nerve, rises in the distal 1/3 of the forearm, and it passes medially between the tendon of the flexor carpi ulnaris and ulna. It is distributed on the posterior surface of the hand and the finger. An important point in the dorsal cutaneous branch of the ulnar nerve, it is supplied the skin over the medial 1/3 of the dorsum of the hand. Thank you.